that now has taken 3,000 American lives. I believe in the last reports that it will certainly surge past 9/11. It will be more than our 9/11. And so it is crucial as we who are leaders and elected officials collaborate with each other, stand with each other in social distancing, to be a role model for our constituents, and as well provide them the necessary comfort and understanding that is our responsibility. Today we say to those throughout this region, we will not panic, we will simply prepare. In the words of our chief leader of the National Institutes of Health, in order to save lives, in order to get in front of the pandemic for places like Texas and many other states, it is to test. It is to do massive testing. Dr. Fauci has indicated that the nation needs to continue to do massive testing to provide the data that is necessary to ensure that we are able to know how to treat. Our treatment protocols are just beginning. For this reason, I am very proud to be in the district of Congressman Pete Olson and the many other elected officials, the mayor, to announce the opening of the Smart Financial Center testing site run by United Memorial Medical Center, who feels a compassion and need to reach beyond its anchor hospital that has been testing since March 19th at 510 West Tidwell. It is again to save lives. If we need further affirmation, many of us remember General Honore, who led the recovery and fight to save lives after Hurricane Katrina. He is now joined in the effort, and his words are to save lives. His words are, in fact, we have to care for those who are already sick. We have to test for those who have not yet reached that threshold. That is why we stand here today. And so as I yield for a moment to all of these who have come to be an inspiration to those who will watch and listen, to keep them calm, let me also raise my voice in appreciation to all of the medical professionals everywhere you are, to all of the essential workers, all of the police and fire, sanitation, people who have to come to work. Let me add my appreciation to you and my great thanks. Let me also add my desire for anyone that is a retired medical professional to be able to either join those in New York or stand by for this community, meaning the whole state of Texas, may be needing your services. Stand by to be able to go to your local hospital and acknowledge that you are there to help them. Finally, I want to say that all of us, no matter what our faith, we need to lift our voices now. Thank all of our faith leaders, whether they're in a temple or a synagogue, a mosque, or whether or not they're in a church. All of our faith leaders, we ask for the mountainous of their prayers. And we know that, if I might say, the prayers of the righteous in the Christian faith availeth much, but we know there's an array of faiths, and we want all of their voices, respect all of them, to be able to lift their voices in prayer. With that, I'm delighted to be able to ask a senior member of the Energy and Commerce Committee in the United States Congress, a friend and colleague, Congressman Pete Olson, to join us at this time.
Welcome to my hometown of Sugar Land, Texas. And thank you y'all for coming. Special thanks to my good colleague, my dear friend, my apartment floor mate in Washington, D.C., Congresswoman Sheila Jackson Lee. Y'all know Sheila is a true icon of public service, and not just D.C., but throughout the world. A special guest is here as well, our new county judge, KP George. KP has done outstanding getting this county through this process so far, this pandemic flu. A lot of work to do, but thank you, KP. My hometown mayor, Joe Zimmerman. Thank you, Joe, for all your hard work for our hometown of Sugar Land. They say a picture speaks 1,000 words. And with the help of our good friends at UMMC, this free, I say again, free COVID-19 testing facility is open right now. And what makes this so amazing, I came by here about this time yesterday. This is the picture I took. That tent right there with one side, within 24 hours, working all night, these heroes got this thing up and running. So Dr. Varon, all you people at UMMC, thank you, thank you, thank you so much. As my colleague mentioned, we passed a strong bill to help Texas recover the whole country. $2.1 trillion coming here for test kits, for respirators, for gloves, all these things we need. My plea to all my fellow Sugarlanders is stay at home. Only go out for essential things like groceries, medical appointments. Other than that, stay at home. If we stay at home and get tested when we think we have symptoms, we'll come through this better and stronger than ever before. And now it's my pleasure to introduce a man who needs no introduction here in Sugar Land, Texas, our great mayor, Joe Zimmerman.
Thank you, Congressman. I want to personally thank Congresswoman Sheila Jackson Lee. Thank you for your role in facilitating this. I want to thank United Memorial Medical Center for their resources in providing free testing to not only residents of Sugar Land, but residents of Fort Bend County and beyond. And I want to thank the men and women of Sugar Land, our police department, our fire department, the first responders that have been working with United Memorial Medical Center to get this set up. I think this is unprecedented. This is the first private funding. This is free testing for residents. So again, Congresswoman, thank you. Thank you to the other elected officials, Judge George. I know we've got Representative Ron Reynolds is here. We've got a number of our elected officials that are represented, and we want to thank them for their role in helping facilitate that. Thank you.
Let me thank the mayor as well, and let me take a moment to acknowledge these outstanding leaders. And as I do that, then I will call at least a number of them to come. But let me acknowledge them now. Certainly, County Judge K.P. George. I'm here. Thank you. Representative, State Representative Ron Reynolds, a special appreciation for all of his help. Judge Joel Clouser, Fort Bend, and as the mayor said, Fort Bend, Sugar Land. Judge, thank you very much. Dr. Candace Williams, Texas Coalition of Black Dems. Constable Darrell Smith, again, Fort Bend, Precinct 2. Thank you for the frontline works that you have. The totality of physicians from UMMC, and obviously you have a facility here in this area. We're so grateful to you. So let me just take a pause for a moment and acknowledge the great team that is at this great hospital. Our leader, visionary Saeed Mohudin, CEO. Dr. Moen, CEO of Operations. Dr. Joseph Varone, Chief Medical Officer. We will hear from him in a moment. And all of the team that we're so grateful for. Dooney Hebram, I don't know how to describe her, but she's government and federal relations, and we thank her for an enormous amount of passion and heart that has been part of this great team. So let me for a moment ask Dr. Varone to be able to come forward. I want to take a little bit of his message, and I won't take it all because he is entirely too well informed, and I do not pretend to be a physician. But what I will say is that we are so grateful to this community to welcome us. Mayor, Congressman, you know that we put a lot of money in, you're in Energy and Commerce, on medical care. And it is well known that we don't leave spots untested, areas untested. Even as big as Houston and Harris County is, we have places to go in that area, and we'll make that known shortly. But we don't need to leave places untested. And we have been finding that in this community, people under 50 are positive. That our seniors, however, need to come out to be tested. So we have two challenges for this community. Don't forget our seniors. If you can bring your seniors to be tested, please do so. And young people or people under 50, don't think that you are not vulnerable as well. If we get those messages out, we listen to Congressman Olson, who said in his community, stay at home and come out for essential reasons. Obviously, the essential reason may be the testing line that you'll be in. So let me now ask our Chief Medical Officer, Dr. Varone, to come at this time.
Thank you, Congresswoman, Congressman, Mayor. Thank you for allowing us to be here today. It is important that the general public is aware of the numbers, what's going on out there. At our Tidwell facility, we have tested close to 2,400 people, of which 9.1% are positive. These are numbers that have been going up. We started at 5% and 6%. Probably the numbers are about the same, but we're testing more and more and more. Having the opportunity to test here in this area clearly will show that those numbers will continue to increase. If there is one message that I have for the general public, is just like the Congressman, just like the Mayor said, just like the Congresswoman said, stay at home. I cannot say it enough times. Stay at home. Social distancing, staying at home. If we do this right, we will control this pandemic. I mean, we have controlled the plague, we've controlled many other things in the past. We will survive this. But if we don't stay at home, this is just going to prolong more and more and more, and we will have more casualties. And we really need your help on this. Thank you.
Representative Ron Reynolds, State Representative Ron Reynolds, we thank him for his help, and we ask him to come at this time.
Thank you, Congresswoman Sheila Jackson Lee, for your leadership, not only in the 18th Congressional District, but obviously out here in Fort Bend. I'm very grateful for United Memorial Medical Center for offering your great services for free for our constituents. Mayor Zimmerman, Congressman Olson, Judge George, we're very grateful. This is a great collaboration. It shows how strong we are as a community when we all come together, regardless of party affiliation, regardless of any social, economic differences. We're here today to stand strong to fight this pandemic, the COVID-19, the coronavirus. And we know that because of our collective faith, because of us working together, that we're going to overcome this. We're going to press forward, and we're all going to make sure that our communities are safe. I want to just encourage everyone, just like Congressman Olson said, and reiterate, we can't say it enough. Please stay at home. If you're not an essential worker, our hospitals cannot handle the influx of people that can possibly be infected if they're going about their daily lives without the social distancing, without sheltering in place. Please be mindful of that. I know that people are weary. We know that the President Trump recently extended it to April 30th. But regardless of how long it takes, we are more safe if we stay at home than we're gathering in the public. This is a highly contagious disease, and we don't want people to be unnecessarily impacted. So we want to thank our first responders, our great police and fire, our paramedics, our healthcare workers who are putting their lives on the line every day for us. And so I just want to say thank you. And thank you for all of the stakeholders that helped make this happen in a short order. This is a tremendous benefit to the citizens of Fort Bend County and also beyond. And so I hope that everyone would take advantage of this, because once you get tested, then you'll know for sure whether or not you've been impacted with the coronavirus. So again, thank you, Congresswoman Sheila Jackson Lee and Dr. Verone, all of our great people that are assembled here behind me. And thank you so much for bringing this to Fort Bend County.
Thank you, Representative. Now, as you well know, the county and city works together, and I would appreciate to have our county judge, Judge K.P. George, to come at this time.
Good morning, Congresswoman. Good morning, Congressman, our mayor, state representatives, all elected officials, and also the community partners. And I just wanted to say, in Fort Bend County, we are very blessed with a lot of wonderful people working to make this situation whatever the best level they can. As of last night, we have 138 confirmed cases in Fort Bend County. 12 days ago, we are talking about 15 cases. And so this is a serious issue, and we have 9 recovered. That's a good news. And sadly, 2 people lost their life to this pandemic. And so, you all heard so many people saying, I issued an order and we will evaluating it. We are evaluating it, and we will possibly extend it a little bit further so that we could, deal with this pandemic. And so I just wanted to say, this is the 3rd testing site in Fort Bend County, and we are working so hard to bring more, and we are in the process of doing that. And thank you for all your cooperation, and let's work together. And once again, you heard this before. I just wanted to say, we are asking you to stay home, but there are people working 24/7 so that you could stay home and safe. And so please, when you see a first responder, when you see somebody in uniform, when you see EMS workers, thank them. Just say thank you to them, because they are working 24/7 to make us safe and and they are in the forefront. So I just wanted to leave prayers for them. And when we all kneel down and pray, remember all these people behind the scene to make Fort Bend County a better place. And thank you once again for each and everyone here. And let's test more people. And these numbers are expected to go up before it go down. So when we test more people, we are better off. So let's continue to work. And this is an amazing accomplishment. And thank you for Mayor Zimmerman and his team opening up this place, because it's easy to get in and out. And so let's continue to do this so that we could put a halt to this pandemic. But at the same time, the message I wanted to leave, you have to live in peace. We cannot live in fear, but be cautious. Thank you very much.
Just point set that.
Go right here, Congressman.
How great this is. Y'all are watching us speak. What's happened since we spoke? That black pickup truck and that white truck back there have got checked in here, tested here, results there. Like that, and all for free. So thank you again to UMMC for all your hard work. This is happening right down here in Fort Bend County. It's happening in Texas. I yield back.
Sorry, that's all right. You are a great partner. Let me conclude and open it for questions by simply saying and re-emphasizing what my colleague said, but to make the point that there are going to be 3 that the contagious factor of the coronavirus is 3 to 2 times more so than the flu. Presently, we're very proud to say that a number of research protocols are being addressed right here in this region, which would include the Texas Medical Center on treatment issues, but as well vaccines. We're testing treatment protocols right at the United Memorial Medical Center. So our medical professionals are working. We have to work with them in what we can do, and that is to be able to give comfort to our constituents. So if we can view this as a journey, The medical leaders nationally believe that we might be surging even as late as May, the beginning of May. And with that in mind, one of the things we have to tell people is that long is not long. That in actuality, long is really to save lives. It is a journey, and you'll have some mountains and you'll have some valleys. But if you can view it as a journey, and one that when you get on the other side, you'll be at a place where you will be pleased to be. That's the message we have to keep saying. Take care of your elderly. Congressman, I'm getting people who are getting food insecure. We're going to be pushing money out to be able to ensure food security throughout. Mayor Zimmerman and to the county judge, because of the leadership of Congressman Olson, and I was glad to work with him because we know about our communities, you will get direct payments from the federal government for any of the overtime, any of the work that your county and city personnel are doing, all of the law enforcement. You'll get direct payments to you, and we wanted that to happen because we are very confident in your leadership and the leadership of the county judge to ensure that those monies will come. So let me open it up now for questions with the comment of prayers and the comment of needing your prayers and the comment that this is a journey that we will get through. Any questions, please?
The expansion of this with the new capacity for testing is between this center and the other one on Tidwell?
Well, we will continue to work on Tidwell, and in fact, we expect here to do at least 250 tests every day. Today will be a little less because we're starting a little later, but we will continue Tidwell, and we are going to open on April the 2nd a new site at the Forest Brook Middle School in Northeast Houston. And so we're going to continue the work that we're doing. Based upon, again, science, the National Institutes of Health has indicated that in pockets where we're not like the epicenters, that we need to test.
So what through UMFC?
Yes, yes, yes.
So can
The-
you talk?
Yeah.
Can we talk about? Talk to us a little bit about the funding. There's no upfront cost. You guys charge insurance. How does that work? Can you explain that to me, sir?
Yes, there will be no.
Can you come to the mic, please?
Yes, there is no upfront cost for COVID, and for COVID testing is completely free for all the patients.
So there's no. You said there's no upfront cost. So there's no copay.
There is no copay. We're not charging insurance for COVIDs.
You're not. So how are you? Are you just eating the cost, the average $100 a cost, or how's that work? Can you tell us?
We hoping we here we wanted to help the community, and we are privately getting funded. We're trying to see if we get sponsored, but so far we are funding privately.
By your own medical
Yes.
facility?
Yes.
Because all the other private facilities charge cost, which is about, $51 for the base price plus cost. So I was just wondering how you guys are doing that and how long you will do it.
No, we are absorbing that cost.
And there's no charging of insurance?
No charge to the insurance for any COVID-19 testing.
And what kind of testing are you guys using? Is it your standard swab test?
It's a standard nasal swab test, and then we partner with the reference labs who does our testing of the kids.
What's the turnaround time for that?
Somewhere between 24 to 36 hours.
And what's your anticipated of how many you're trying to test? So between this site and your other site, you're doing 500 tests a day to capacity?
Yeah, some between 4 to 550 capacity right now.
And as far as the products that you're getting, the PPEs and all your testing, how are you able to acquire all of that?
From different sources nationwide, we're buying privately from different distributors.
Are you worried about running out? Is that a new concern?
There's always a concern of that. Obviously, we are a community hospital. We are privately funded, and there's a limit. We have limitations. So obviously, there's a huge concern for that.
Regarding funding for the test, just to further, are you guys trying to access a grant, anything like that, any kind of federal funding for reimbursement?
We will access whatever available to us.
Have you accessed any public funding?
Not yet.
Have you applied for any?
Not yet.
Have you gotten any public support in any kind, other than the elected officials here?
No, ma'am.
Regarding the conservatory up in the Woodlands, do you have any information on that situation there?
I cannot discuss that. I will have Dr. Varone, chief medical officer, talk about that. Yes. Thank you. Thank you all.
You can't. Yeah.
And the question was what?
We just set the mobile unit up. They
Yeah.
have
Yeah.
tested.
So, I mean, the question is, we are now, or we're going to embark in having mobile units so we can access those people who are in most need, you know, the elderly, the ones that cannot come out and get tested. We're going to send them a van, a UMMC van that's going to go test the people over there and come back.
Tested them twice.
And we've done already a couple of tests. What is surprising is that many of those patients are positive. So that's a concern that the Congresswoman has had. We need to reach that population.
Do you have a specific number on the positive tests?
No, at the present time I don't.
I'm always, I'm not a doctor, but I'm always concerned about making sure they comply with all of the confidentiality. So some of that, if the facility chooses to make matters public, they choose to do so. We want to be very attentive to the privacy of these individuals coming through. You haven't heard anything about them except that we do report every day, not every day, but we report our numbers to the county and to the city and to the CDC. That's what we do. And we give, we retain the personal information, but we give the demographics of age, you know, what was the basis of them getting tested. They traveled, they were exposed to someone, so that we can give the national organizations like CDC accurate information, because that's how they're tracking how this imploded. I would also like to make a plea for donations. I just know how generous this community is, and so I know in this community, UMC is here, other facilities are here. I can assure you that sanitized, clean PPEs are always welcomed, masks are always welcomed, and gloves are always welcomed. We would clearly appreciate you sharing that information out. I'm going to take the moment to thank the media that has come out in all of the announcements that various organizations have made. We're trying to get information out. As I indicated, we're looking to be at Forest Brook Middle School, and I'd like to give that address in a moment. But in any event, that'll be at Tidwell, and it'll start on this coming Thursday, April the 2nd, 2020. But we will welcome the support of all of the communities to help us save lives. Any other questions?
Do they have to be symptomatic to be tested? I forgot.
We have a screening. I'll let the doctor come, but we have a screening process, and there's a myriad of questions, but symptomatic as well, but also traveling. Yeah. Have you traveled anywhere?
I'm sorry, Steve. Once they get screened, they get this kit put on their windshield. You can see it right there in that Jeep. That's their testing kit. It goes there to be tested, swabbed, and then they go there for the results.
Correct that.
You have the address? Okay. So they ask those questions. If they've traveled, that is an important point. If they've traveled, I mean, we find that to be a major element. You travel from Louisiana. You just came in from Michigan. Those are well, I don't want to call those states out, but we certainly know they've been in the news. So I think I can fairly do so. I think you know what the standards are. The Forest Brook Middle School is at 7525 Tidwell Road, 7525 Tidwell Road, April 2nd, starting probably at a little after 10.
And Congressman, do you believe we should have a statewide shelter, stay-at-home order?
I think we may be moving to that based on science. I'm going to maintain that the medical professionals should be consulted, and we hear nationally that there are surge moments coming, and so if that will save lives, and the state leadership, really I think the state leadership needs to be consulting with mayors, county officials, to be able to see what is best. When I say consulting, having them engaged in the discussion, and science. I'm not going to step over the boundaries of science, And so that's why we are maintaining our testing protocols and trying to reach as many people as possible, as these individuals are. Many of you know in the stimulus, we were concerned about our hospitals and the expenses that they're expending. Hospitals everywhere are testing people, whether it's small numbers or large numbers. And so we do have in that $100 billion, which may need to be more, for hospital expenses. And so if you are a Medicaid or Medicare recipient as a hospital, at some point down the road, you'll be eligible for your expenses, somewhere down the road.
What was the cutoff number for the number of people that you guys are testing?
250 daily, and probably under that because we're starting a little later.
Did you guys cut the line off already?
I'm not in the line, so
It's under 200 today.
It's under
Yeah.
200 today? Yeah, they were saying, the cops over there were saying that the line was.
Yeah, because we started late.
We just didn't want to go on TV and be like, oh yeah, come on down.
yeah.
Yeah.
Come on down tomorrow, though.
Make sure they have some pre-clearance. They can fill out online or talk to doctors. You just can't show up.
There's no-
Correct, guys? You have to have on your website.
No.
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 No. You get screened over there, but you checked in before them. That's when you're sort of come up and say, hey, here's my reservation. They get you going. But so, tell your viewers and listeners, go to the NMCC's website or UMCC's website or get a doctor's orders. Come with that arm. So you can get screened, swabbed, and results like
Okay, so
that.
there are things that you have to do before you come down. I'm sorry, sir, what's your name?
Have to register.
Syed, S-Y-E-D, last name Muhyiddin, M-O-H-I-U-D-D-I-N.
The congressman is correct in some of the county and city sites.
Yeah, we're talking about this site.
This site,
You don't have to register.
you don't register, you come up, he's right on the county and city sites. On this site, you are assessed for symptoms and information here. And so someone who has traveled is legitimate in coming to indicate their travel dates or their family's travel dates. And there are no age limits, so a child can be tested as well. A child can be tested as well. So here you are assessed on the grounds, as the congressman said, in other sites that are government run, you have an app or a phone call information to make. You can access that in whatever county you live in. But in this instance, at the Smart Center in Sugar Land, in Fort Bend County, or a portion thereof, you can come and be assessed right here. Any other questions?
To the doctor, his assessment of what treatments are working right now and what have you found in the last 4 years?
Okay, that's actually a great question. As the Congresswoman mentioned, there are a lot of research trials going on. There is some good data on the use of hydroxychloroquine combined with the Z-Pack. We are using a combination that includes vitamin C, thiamine, and zinc. And so far, we've been successful. I mean, there are small numbers that we have treated, but we're now part of what is known as the COVID registry, where everyone that is working on COVID patients is entering their data, and we're all brainstorming at the weird hours of the morning as to what are the best options for these patients. So these treatments are for people who are very sick. It doesn't mean that everybody that has a cough needs to go out there and try to get hydroxychloroquine and Zithromax. First, they are not going to be able to find it because most pharmacies are off. And second, we really need to reserve it for those who are critically ill in the hospital.
Any other questions, my friends? We want to acknowledge Reverend Terrence Hall. I know that he was on a call that I was on. I thank him so very much. And the faith leaders are going to be extremely important for our work. But we're going to continue to try to utilize this instruction from the national scientists to be able to help. And again, let me thank, as I conclude, Congressman Pete Olson, who has provided vital information this morning. Congressman, thank you. Thank you for the collaboration and as well friendship. Mayor Joe Zimmerman, thank you for always being available and leading this city. County Judge K.P. George, State Representative Ron Reynolds for your on-the-ground help and assistance. Judge Joe Clauser, who we know many issues may be coming before our courts. Fort Bend Precinct 2, Justice of the Peace, Dr. Candace Matthews, who is here, and as well Constable Darrell Smith, Fort Bend Precinct 2, all of our physicians, and Mr. Mohidin, who is the CEO, Dr. Moen, who is Operations CEO, Chief Medical Officer, Dr. Joseph Barone, who has been a vital part of the treatment protocols that have been so vital, and a person who has guided us through all of these sites and setting them up, Dooney Hebram, who is the Federal Relations Officer. With that, we ask for the prayers of all, and we ask for the prayers of those in whatever faith they walk, because we do believe that as America takes this journey, the world will be watching us, because we are such a large presence, such a large humanitarian presence. We now go through our own crisis, facing a crisis that has killed more people now than 9/11. It is a crisis I believe America and this great state, this great community, I think that we will overcome, we will achieve, but we must go through this journey together. Thank you all so very much. God bless all of you, and God bless the United States of America.